this video you can see the lumbar curvature that is exaggerated. That is what we call exaggerated lumbar lordotic. So for that we can do the hip stretching. This is hip flexor stretching. There is a muscle in the front of the hip that is, if that is tight, that will leads to, we call it as pelvic tilt, anterior tilt. To reduce that, we can do this. Next is child pose. Child pose. This is also a stretching position. This also should hold for 20 seconds. Okay, the next one is it's called donkey kick. This is also for the strengthening of the glutes muscle. By strengthening the glutes muscle, the tilt, the anterior tilt will become neutralized, and the curvature, the low back curvature will become good. So that is the lumbar lordotic, exaggerated lumbar lordotic will become normal. So next is the hip extension. Hip extension exercise is also, it is mainly isolated exercise for gluteus maximus. That is the major muscle for hip extension. And there is, it is actually a synergist. Along with other muscles, low back muscle also, it is working. So the last one, that is which we call the bridging or hip thrust. In gym, we had seen that these muscles, these exercise which we are doing is by, hip thrust. So adding more weights over the hip area or the front of the hip area, we can do the hip thrust.